Good afternoon. Thank you for streaming with us here on CBS News Chicago. We appreciate it. We're going to talk monkeypox. That is topic A, especially in the medical world. Concern for parents, concern for festival goers this weekend. Now have 603 cases confirmed in Illinois. That is the third highest confirmed case count in the United States. Third to New York and California. President Biden has now declared monkeypox a national health emergency. Also, there may be some wording changes, some naming changes going on. Monkeypox may now be called MPV. It is being called MPV in many different corners. So we're going to sort things out with an expert we're happy to have here on the stream with us this Friday afternoon. Expert Dr. Katrine Wallace, an epidemiologist and adjunct professor. Doctor, we appreciate you joining us this afternoon. Thank you. What's the latest you know? What's the latest you can tell us? What's the latest kind of headline that people need to be concerned about when it comes to monkeypox or MPV now?
Thank you so much for having me today. Yes, monkeypox is on the rise, and people should be aware of it. It is predominantly occurring in men who have sex with men right now, but we need to be clear that monkeypox, anybody is at risk for monkeypox. It spreads via close contact with other people. And right now it has taken a foothold in the MSM community, but that there's nothing kind of biologically predisposing that group of people to monkeypox. So anybody should be aware and know how to prevent, and we can talk about that today.
Yeah, so that's where it's confined to, or at least most cases are seen right now, but can easily spread beyond that, via
Correct.
bed sheets or via sharing a drink. Yeah, go on. Data.
So some data from the WHO at this point in time, it's 99% of the cases have been men. And of the cases that have provided information on their sexual orientation, 97% are men who have sex with men. But as we were saying, every infection is a chance for spillover into other groups. So this is our chance to contain it.
So in Chicago this weekend, it's one of the biggest festivals, probably most popular festivals among the queer, the gay, the LGBTQIA community. It's called Market Days, 300,000 people, closely gathered, hugs and cheek kisses and partying with shirts off, so on and so forth. I mean, that it's going to happen. I mean, you would warn those who are going to go to Market Days this weekend, you would warn them what in Chicago?
Yeah, so that's a great question. And we want people to enjoy the weekend and have a good time. Shaming people for going to events is counterproductive. And after a long pandemic, which we are still not out of, we do want people to see their friends and have a good time. There are harm reduction methods that we can use to keep everybody safe during this weekend and moving forward into this outbreak. Reducing partners is one really good way to reduce your chances of monkeypox. Also, you could even limit your sexual partners to pods of people that you trust, like in the early days of COVID, how we sort of tried to keep people together in pods. You mentioned the shirtless dancing. Wearing a shirt will protect you when you're in like a hot, sweaty, skin-on-skin club dancing situation. Also, just people should check their body, and if you see any pustules or pimple-like rashes, maybe get that checked out before going to events. And also know the people that you're with. We have a problem with contact tracing for some of these cases because there's a lot of anonymous sexual contact going on. So just know the people that you're with and their monkeypox status if possible. And also don't share like bedding and towels and with other people that you don't live with.
Okay, Dr. Kat, great advice. Dr. Kat, you are also a hit on TikTok. Nearly 300,000 followers, 5 million likes. You did a TikTok, and I'm a little aged out of the demo, but I think it would be called a TikTok. Do you call it a TikTok or a video? Whatever it is. You did a TikTok that talks about this very topic. Let's take a look at that.
Dr. Kat, epidemiologist, if you encounter someone with monkeypox during the following activities, what are the chances that you will be infected with monkeypox? Let's go. Sex, highly likely. This is how this outbreak is spreading. Close, prolonged, skin-on-skin, physical contact with other people with infected lesions. Kissing and sharing drinks. Likely you are having contact with that person's bodily fluids. Saliva. Skin-on-skin dancing in a crowded club is possible because you are skin-on-skin. You're having contact. If someone has infected lesions, those could rub on you. So wear a shirt. Handling clothing or bedding of a sick person, it's possible if you are touching those things in a room where the person has been sick or wearing the clothes. It's unlikely that you would get it from trying on clothes in a store. Also things like the coffee shop, the train, the pool, the gym, your coworker who was exposed. These are all very low risk situations.
Dr. Kat, that's some great advice and a great breakdown there. So, I mean, you run the gamut of scenarios. By the way, Dr. Kat is Epidemiologist Kat with a K, Epidemiologist Kat on TikTok, 267 followers, 267,000. I just checked mine. I think I have 159. Not very active, but I'm TV Brad. Maybe we can follow each other.
Yeah.
So. Also, let's go beyond the question, in the queer community, but go beyond that. And I know parents are really concerned about this right now because there is going to inevitably be some spillover, and then if it gets into the child population, anyone who is dealing with kids, uncle, whatever, they can just be a din for spreading, virus like this. What do parents need to do now or not need to do now? Do they just need to take a wait and see approach or a more proactive approach with their kids when discussing this and, what you call harm reduction practices?
Mm-hmm. So what I've been telling parents and teachers actually is that we need to kind of counsel the children, explain what's going on in a not scary way, and really tell them not to touch people's skin, to keep our bodies to ourselves, and really drive that point home. And kids were very nimble in adapting to masking and COVID precautions. So I think we give kids not enough credit in how well they're able to adapt to things, especially in a classroom situation. I know some of the younger kids, it may be more difficult, but if you really tell them how important it is to keep our bodies to ourselves and not touch our neighbor and things like that, I think that will help if these messages are reinforced at home and in the classroom.
Okay, so you say now is the right time to be having those discussions.
I think so. For COVID reasons too, right? We have another pandemic that's going around, and so we don't really want close contact for multiple reasons. So yeah, it won't hurt.
Who would have thought? Oh, pandemic, now this. So let's have a discussion. There is a move here. We're kind of going to get into the wormhole a little bit, but we can do that. And, educationally, people want to know. There's a move now, monkeypox, to call it MPV. Is that because there's a stigma, a pejorative, a connotation about monkeypox versus MPV? Then will people get confused if they don't hear monkeypox? What's this MPV they're talking about? There is a move afoot now to not rename it, but call it MPV versus monkeypox. Can you take me kind of into the weeds about this?
From what I understand, it's really a movement that's behind sort of destigmatizing it on several levels, right? So we know that the first cases of monkeypox originated in Africa, And there's a long history of racism with the term monkey, and that has been upsetting to people that it's kind of still keeping this name, and especially because the disease itself really has absolutely nothing to do with monkeys. The primary reservoir, even when it was just an animal illness, was rodents. And it just so happened that the first cases were found in monkeys, but those monkeys had been bitten by rodents. So it really has nothing to do with monkeys, and the term can be racist and harmful to certain communities, and it just is better to not use it.
That's interesting insight. So it started with rodents, and so the original terminology must have come because the first cases were seen in Africa?
That's right. It was the first cases were discovered in monkeys in Africa, so they called it monkeypox. It's an orthopox virus that's very similar to smallpox, and that's the reason that we're using the smallpox vaccine, Jynneos, to try to control this outbreak, because the viruses are very similar, and the smallpox vaccine is 85% effective against monkeypox. So we had a vaccine already available, but that virus was first discovered in Africa in a monkey that had been bitten by a rodent that was infected.
Okay, well, that is a good learn. And honestly, and it's fun to have extended conversations, especially with luminaries such as yourself, because we do get to learn a bit here and there. So the smallpox vaccine is being used for or protectively for MPV, monkeypox now, and I believe it is. Can you kind of tell me how it comes out? What the rollout is? I know it's only being given out to those who are seen as extremely high risk right now. Is it a one doser? Is it a two doser? How long does it take to take effect?
Yeah, it is a 2-dose vaccine. The vaccine is called Jynneos, and it is the first dose is given, and then another one is given after 28 days. So it just has to be a minimum of 28 days. Now, right now in Chicago, we are only giving it to men or people that are first-degree contacts, sexual contacts, or close contacts with a diagnosed case, or men who have sex with men that have other risk factors like multiple partners and so forth, or have engaged in sex for money or something like that. There's a list of other risk factors for the MSM community. So it is people, as you stated, that are at very high risk for monkeypox infection. So if you get the vaccine, it is 85% effective at preventing monkeypox after 2 doses. Most of the benefit comes from that first dose, but you really need 2 to get the lasting protection. And Chicago right now is prioritizing first doses of vaccine because they want to try to get as many people vaccinated as possible, and we do have short supply at this point. So it'll be a while till everybody gets second doses, but I'm actually volunteering in the monkeypox vaccine clinic for the city of Chicago, and I'm just telling people to set a timer on their phone and make sure that they start to look for a dose after 28 days.
Okay, good to know as well. So for the full efficacy, prevention, which is 85%, smallpox vaccine used for monkeypox, MPV, it needs to be 2 doses, and then so that would be probably from the first dose to after 28 days. So is that immediate? It's full efficacy right there, or is it weeks after that?
So that's a great question. It is about 14 days until the dose takes its full effect. So correct. It's like the COVID vaccine where there's like a 2-week period where your immune system is kind of priming up.
Okay. So basically, if you get the vaccine today, you're looking at 6 weeks before you will have the benefit of full efficacy with the vaccine. These are all good things to know. So,
yes, very good.
How do you see this playing out, Doctor? Do you see, just the cursory Google searches? I haven't seen an outbreak like this, and these numbers. And you got to keep in mind, if you have 603 confirmed cases, several hundred of those in Chicago, one would imagine there are probably many, many more unconfirmed cases, especially this thing can lay dormant for up to 21 days. Basically, you may not even know you have it for the first 3 weeks. How do you see this playing out? Do you see all gay men or men who have sex with men, do you see a recommendation sometime soon that all of them get the vaccine, get the double dose? How do you see this playing out over the next several weeks, months?
Yeah, hopefully now that we have declared a public health emergency, we will get more resources to fight this epidemic. That's been the issue, is that we've been very limited in the vaccine that we've had to give out, and also testing supplies have been limited as well. So it's been difficult to fight it on the ground floor, but I will say that the MSM LGBTQ plus community in Chicago has really risen to the occasion, and I feel like the health centers like Howard Brown and some of the business owners in the community have really made space for vaccine clinics and educational purposes. And I feel like the people that come into the vaccine clinic, the patients, are pretty well aware of their risks, and they seem pretty, the community seems pretty educated. So I feel like the community really has been showing up for this. It's just the resources that we don't have to fight it. It's not the community not showing up. It's that we don't have the resources that we need.
Yeah, resources being actual vials, actual doses of the vaccine yet. And it's duly noted. Even the Market Days organizers, who a lot of money goes into this festival, and it's a fantastic festival. And, it is a bullet point headline on their homepage talking about this issue, which is obviously key to education, key to prevention, yes, key to knowledge, and also key to, not only harm reduction, but vaccinating people. And but let's talk, because there's always information and misinformation. You have a great TikTok. Again, it's Epidemiologist Kat. We're talking with Dr. Katrine Wallace, an epidemiologist and adjunct professor at the University of Illinois Chicago School of Public Health. This TikTok in particular you posted speaks about cutting through misinformation to get to information. Let's take a look at that.
Hello, and welcome to Is It True or Are You Misinterpreting Statistics? I'm Dr. Kat, epidemiologist, and here's today's guest.
On admissions in the unvaccinated, 17 in the partially vaxxed, and 210 in the fully vaxxed.
We talk a lot about the base rate fallacy on here, but usually it's not this obvious. So she's given us the numbers, the raw numbers, which we talk about all the time in a highly vaccinated population is not appropriate and doesn't give us a picture of vaccine effectiveness. But this example is just stunningly bad because the rates are right on the table and she just skips over those columns.
So, I mean, there you point out how, in many cases, easily it is to inform yourself when you're being given misinformation, and how you really have to be wary of cherry picking facts, which seemed to be the point you were making against the person who was espousing the data in that case. Let's get back to monkeypox and MPV.
Yeah.
Average Chicagoan, I mean, anything they need to think of beyond almost COVID concern level preparedness and harm reduction?
I mean, as we were saying before, we know that this has kind of gained a foothold in the MSM community. However, everybody is at risk for monkeypox. There's nothing biologically predisposing an MSM or gay person to monkeypox. So everybody should be aware that if you have new partners, multiple partners, that it could spill over at any time. We haven't really had a lot of that yet, but it could definitely happen, and especially places like college campuses, prisons, homeless shelters, some kinds of athletic facilities. These are places where there is close contact, and we would want to, at least especially in those situations, be aware and educate people.
Okay, you talk about MSM, and of course that's just kind of breaking down everything. It's men who have sex with men.
Oh,
That's
yes,
where they're seeing
sorry.
the predominance of the cases right now. There's maybe, of the known cases in Chicago, 478, at least 1% identify strictly as straight. And you've said, probably 97, 98% are somewhere in the rainbow spectrum, which can be bisexual, homosexual, so on and so forth. I thought it was really important, though, again, with Market Days this weekend, one of the biggest LGBTQ events happening in Chicago, 300,000 from the rainbow expected for North Halstead Market Days. And it's going to be a beautiful weekend. And you did that great TikTok about kind of the, almost ranking what practice and how dangerous it is. Do we have that TikTok ready again, guys? Can we show that one more time?
Dr. Cat, epidemiologist, if you encounter someone with monkeypox during the following activities, what are the chances that you will be infected with monkeypox? Let's go. Sex, highly likely. This is how this outbreak is spreading. Close, prolonged, skin-on-skin, physical contact with other people with infected lesions. Kissing and sharing drinks. Likely you are having contact with that person's bodily fluids. Saliva. Skin-on-skin dancing in a crowded club is possible because you are skin-on-skin. You're having contact. If someone has infected lesions, those could rub on you. So wear a shirt. Handling clothing or bedding of a sick person, it's possible if you are touching those things in a room where the person has been sick or wearing the clothes. It's unlikely that you would get it from trying on clothes in a store. Also things like the coffee shop, the train, the pool, the gym, your coworker who was exposed. These are all very low risk situations.
She's epidemiologist Cat on TikTok. Dr. Cat Wallace to us. Dr. Cat, any final thoughts as we leave you? And thank you for your education on this afternoon. Any final thoughts?
I just wanted to say that anybody that is attending Market Days, the City of Chicago, the Chicago Department of Public Health will be there on site. And there's going to be information, education. They're going to be handing out information. Then the CDPH has done a really great job during this outbreak with the resources that they have. So if anybody wants more information about monkeypox and doesn't know who to ask, if you're at Monkeypox, there will be resources there for you to ask questions, and they can help you with anything you might need to know.
Dr. Cat, we appreciate your insight. We're going to follow you on TikTok, too. This, of course, our conversation on monkeypox, or MPV, follows a declaration as a national health emergency by President Biden that followed the same declaration on the state level by J.B. Pritzker. We will stay on top of this story, and we thank you for streaming with us this Friday afternoon. Now let's go back to the stream.